wanted to create a space where women were seen as a whole and not a sum of their parts. We're just spending a lot of money on drugs, but teaching people to take back and reclaim their power and use their internal healing systems, that's a harder sell because it takes time. So if you go into fight or flight, you produce a lot of cortisol and adrenaline, and you're revved up all the time. It's like pressing on the gas. When I see patients and treat them, they form a triad. It's like a triangle. At the apex, you have pain. On one corner, you have anxiety. On the other corner, you have sleep issues. And they usually go together. And around we go because we don't think of pain as a hormonal problem, do we? There are a lot of benefits for hormone therapy: your sleep, your skin, your bones, your hair, your brain, all of those benefits. The risks are if you have a breast cancer, you cannot take it. If you have blood clots, you cannot take it. But why we give it is because it's closing the gender gap. Hormones alone can't fix your life. You have to still do the work. Exercise properly, eat properly, manage your stress, sleep properly. So those are things that women still have to be a part of the decision-making process. They have to do their part of the therapy as well. I think an informed woman and a healthy woman has such a beautiful ripple effect. Her friends are healthier, her children are healthier, her husband's healthier, partners are healthier. So having a well-informed, healthy woman has what I call the lovely ripple effect. So if I get one woman back up and running, that means I've affected the whole family. And when you affect families, that affects societies and affects populations. And so it just keeps on going outward. So I love that I'm a part of that journey, hopefully.
Welcome, Dr. Pawa, to Movement Living. We are so excited to have you with us today to talk about women's health. And just before we get into it, for anyone that doesn't already know you, can you tell us a little bit about who you are and what you do?
Thank you for having me. I'm really honored to be on this platform. It's women producing great content for great audiences. So thank you. A little bit about myself. So I live in Vancouver. I have two kids and they're grown up. So I actually am a grandma now. And professionally, I was a pharmacist and then a medical doctor with a very heavy focus on gynecology and obstetrics. So I've always had a very great passion and compassion for women's health. And I had a very busy practice. And now I am focused for the last 25 years on women's health and especially hormones and all the hormones, not just estrogen, progesterone, but looking at hormones of stress as well. So that's what we specialize in now.
What led you to, especially for that last 25 years of focusing on women's health and hormones specifically, was there an aha moment or where did that all start from?
That's a great question because there were several aha moments, but I think the biggest one came when I had a terrible car accident, actually. I was doing a lot of deliveries and I finished doing a very complicated delivery, was on my way home to work to see my own children, and I was pregnant with my third child, and I was hit by a truck. So literally hit by a truck. So it was quite a horrific accident. But the aha moment came when I was wheeled back into emergency as a patient, and I had just left that same hospital as a doctor. So quite a different perspective. I'm no longer in control. I'm having people poke and prod me. And for the next 6, 7 years, because the accident, caused fractures, I lost my baby. There was quite a bit of trauma. I had the perspective as a patient. And while that was a terrible thing to go through, it was an eye opener. And I recognize all the deficits in healthcare. We have a wonderful healthcare system here in Canada. We're very fortunate. And I wouldn't be here if I didn't have the interventions of the emergency room. But what I recognized is that we do not put a lot of focus on patient-centered healing or prevention. And so going through my journey with surgeries and pills, there was a pill for every ill. There were a lot of medication, but no one actually stopped to say, okay, let's put it together. Let's look at the body as a whole. And it wasn't until I went back to medical school to get further training at Harvard, that's when I realized the importance of the nervous system and what is the nervous system. And I came back to Vancouver and I was transformed personally and professionally. And that's when I started West Coast Women's Clinic. I wanted to create a space where women were seen as a whole and not a sum of their parts. And luckily, I met a like-minded physician, Nishi Dawan, and we both started the clinic together in 2002.
Wow, that is an incredible story. I didn't know that. Thank you for sharing that.
Yeah, I actually spoke about it many years later. I didn't want to talk about it was a vulnerable time in my life, but the TED people had invited me to speak about the nervous system, and they really encouraged me to share my story. And so now it's on a TED Talk, which has been viewed by over 1 million people, and they gain uh, perspective from a patient physician who was down there and was able to heal herself, and that was me. So that's what I share.
What you started was this private women's clinic where women could actually come and be treated in the way that you're describing, which I think is such a wonderful opportunity for women because, and we've talked about this before, the challenges that a woman often faces when she's in the medical system. um, and I'd love to hear a little bit maybe from your perspective, um, that feeling of, I guess, struggling to advocate for yourself, or struggling to find your place in the system. If you experience that with your patients, or any advice that you have for women navigating that.
So there's a couple of questions in that question, and I'll speak from the patient's perspective first. And what I hear every single day are stories of women going to their doctor's office, saying that they have mood changes, they have energy issues, they cannot sleep, they're having irritability. And most often, they are either dismissed as, oh, it's just in your head, it's not important, or they're misdiagnosed. And the misdiagnosis is often in the form that you have anxiety, you have depression. So I see a lot of women coming to the clinic, having been to many walk-in clinics or other offices or even psychiatrists, and they come in with a list of drugs. They're on anti-anxiety pills, they're on sleeping pills, they're on antidepressants or sometimes painkillers. And then I help them to connect the dots. Well, does this happen around your cycle? Did this happen after menopause? How many years are you just before menopause? Because a woman's reproductive journey is a bit of a roller coaster ride, which is very unlike men's hormone journey. They just make testosterone, they continue to produce it, and by the time they're, 90, that's when their testosterone goes down. In fact, they make new genetic material every 6 to 8 weeks. We saw Robert De Niro just had a baby, right? So men can continue to produce sperm, whereas women have a finite number of eggs. So we have a very different biology. And that is one of the reasons women's health has been on the back burner. A lot of drug companies did not want to necessarily experiment with women. What if they got pregnant? What about their variabilities in their periods? Just before a period, a woman performs different on a test than she does after. So there were too many variables with women.
Too complicated. We're too
Complicated,
complicated.
yeah, sophisticated. And so this is why, women's health has been on the back burner. But as a physician, I can tell you this is a really great time to be a woman because in the last 10 years, we've seen exponential growth in platforms for women. For example, what you're doing is creating awareness, education. And finally, because we've reached a critical mass of working women and we're making a big difference in the economy, drug companies and researchers are paying attention to women and seeing the biological differences and recognizing that we have to have gender specific health issues. So, as a physician, I feel very gratified that now finally, still have a lot of work to do, but it's in a good place. I think the ball is rolling.
You are a pioneer in women's health because when I started seeing you, and I came to your clinic because I'd had some pretty rough experiences myself, and I came specifically to get some help. What I wanted to ask you is, take us through how you intake patients. Like, how do you assess? You say you assess. Well, what happens when a woman goes into your clinic with, like, I don't know what's going on, or even more knowledge, but what do you do? What is exactly the process?
I'm going to tell you everything in a nutshell because there's quite a process and it's a comprehensive process. So, the first thing is we triage patients to see if they're a good fit for the clinic. So, there's a phone call involved. Secondly, they fill out a very comprehensive intake questionnaire because that allows us to look at the individual variations. We really believe that one size doesn't fit all. And so, taking each woman as an individual, looking at her genetics, looking at her lived experience, looking at her medical history, looking at her lifestyle. So, if someone smokes or they drink a bottle of wine a day, that changes their metabolism, that changes their liver enzymes. So, we want to know what is going on with that individual person in front of us. So, through that intake questionnaire, we then create a working personalized health plan. And when the woman comes in, we'll go through it with her, make sure we haven't missed anything, and then we do a physical examination because I think that's important. There's so many appointments being done virtually. And while virtual medicine has been a godsend, I really believe in the art and science of medicine and laying hands on a patient, making sure they don't have a lump in their breast or a pelvic prolapse or ovarian cysts before we you instigate a treatment. So the whole intake, the physical exam, diagnostics helps us then to create a personalized health plan for that woman. And we are so fortunate because we also have health coaches who also believe in integrative medicine, looking at health, diet, looking at their sleep, looking at their exercise, their movement. All of those things contribute to this beautiful body that we have, which is a multi-system disease. It's a multi-system organ that works so beautifully, but we often divide it up into little parts, and we should look at the body as a whole. And that's what our program does. It's an integrative hormone health model.
That word integrative, I think, is so important. And it's a bit of a mindset shift, I think, for a lot of um, a lot of us that live in the Western medical system. This idea that mind and body are all connected. All of the systems of the body are connected. And I'm curious to hear a bit more about that. That mind body connection that people might think, oh, I have this health issue, I have high blood pressure, or I have, diabetes, or I have, I'm having really bad symptoms hormonally or postmenopause. Like, how does the mind body connection connect in with that?
That's a great question, Amanda, because that is exactly, you just hit the nail on the head, is that our mind and body, although there's a connection, it's actually more of a continuous flow. The mind and the body are not that separated. We have a nervous system, and for simplicity, I'll call it our little engine that's up there in our brain, and it revs up and it was meant to get us out of danger. So if your brain registered a dangerous animal, like a saber-toothed tiger, the brain would say, "Uh-oh, that's danger." So within seconds, the nervous system, this engine would rev up because it would send a signal to your adrenal glands. You make cortisol, adrenaline, and then those are hormones, and hormones are very powerful, as we know. They would make you go much faster for survival. So your heart rate would go up, your blood pressure would go up. So you can see the physical connection, but it began up here in the brain. And so the nervous system is integral to understand if we're going to talk about mind and body and integrative medicine. The nervous system is where it all begins. So if you go into fight or flight, you produce a lot of cortisol and adrenaline, and you're revved up all the time. It's like pressing on the gas. But if you can learn how to regulate that system and put the brakes on, well, then you create different hormones. You make serotonin, endorphins, oxytocin, growth hormone, DHEA, all the hormones that are sustainable for health are produced when you put the brakes on. So think about it like that. And that's how I described it in my TED Talk as well, is think about the gas and the brakes. And most of us are walking around with the foot on the gas pedal stuck to the metal. And when you do that, all that cortisol and adrenaline causes havoc in all our tissues, including our ovaries. So, women who produce estrogen, progesterone, we can't have a conversation about estrogen, progesterone unless we talk about the big bully on the block, which is cortisol. Cortisol impacts how your estrogen and progesterone are produced. So, you see how our thoughts in our mind are inextricably linked to the nervous system. Our thoughts are the language of the mind. Feelings are the language of the body. So I'll say, Gabby, how are you feeling? And she says, I'm tired. I can't sleep. So I could just treat the feeling and give her a pill for that. Or I can go back up and say, wait a minute, if 75 to 80% of our symptoms that we feel are caused by a dysregulated nervous system, perhaps we should go to what's broken and fix the nervous system. And that's what mind body medicine is. Look at the nervous system first and then fix everything else.
Which I know you've been trying to do on me for over 10 years. I,
Yeah.
I must be your worst patient.
No, you've made
Thinking you,
great progress. Are you
I
kidding?
have, you're right.
You're my best student.
I really hear what you're saying, and I do these incremental little things. I know what I'm supposed to do. You've been a fantastic leader for me in trying to get control of my stress. And, I mean, you can't change someone overnight. You are who you are, but I do really value when you say the way you put that is so perfect because really we're just talking about a little tweak, but yeah, thanks for that explanation. It's very valuable.
Yeah, it's such a helpful explanation. I feel like we're getting the science, but also really clear metaphors and imagery so we can actually understand what you're saying without having that medical background. And it sounds like understanding how we can impact our nervous system is really important. So, do you have any advice for women who are like, oh, yeah, I do feel like the gas pedal's on all the time. I do feel like, quite high stress. And now maybe there's some language, oh, that's my cortisol. Like, how can we improve on that? What can we do?
There are so many things you can do, but I like to keep everything very simple, Amanda, so that way your audience can say, okay, what can I do? I'm in a bind. And I often teach first responders and I teach school teachers, and I need to give them tools that they can use in that crux of the moment. And so a very powerful tool is your breath. So when you're born, you take your first breath, and when you die, you take your last breath. And in between, you have millions of breaths, but no one actually teaches you how to breathe. And when I went back to medical school with Dr. Benson to learn about mind body medicine at Harvard, one of the first things he taught me is that your breath is so powerful that you can regulate your nervous system with breath alone. And I said, how could that be? And he taught me that when you take a breath in through your nose, and you can just practice this and hold it for 5 seconds, and then you breathe out through your mouth and you make the exhale longer than the inhale. That act of just doing that, slowing down your breath and holding it, he measured it. I saw this. Heart rate went down, the blood pressure went down, the oxygenation saturation in my blood went up. He even checked the brain waves. So when someone's in stress, their brain waves are going like this, crazy, crazy high amplitude waves. But when you do deep breathing, it changes those brain waves. And when the brain waves change, then the signal going to your adrenal gland to secrete adrenaline and cortisol also changes. So you're actually changing your biochemistry when you do deep breathing. You're changing your hormones, you're changing your serotonin levels. So there's electrical impulses you're changing in your heart and your brain. Our body is fascinating, isn't it? Because you've got biology, chemistry, electricity, physics, and so look at the profound shift you can make just using breath work. And of course, then I'll teach you some deeper things when I go through the Reframe Toolkit. But I think the biggest thing that people learn is that they do have some control over this autonomous sort of nervous system that's always going ticking along, but you can reclaim some control over it by controlling your breathing and learning how to do deep breathing techniques.
That's funny because I was doing that while you were describing it, and I about just about passed out. So I'm not used to doing it. It does work, and then I realized everything in my life, every health issue has been related to the endocrine system, which just tells you it's all about the hormones, and that includes thyroid cancer, breast cancer, all these things, some of which you've helped me deal with. So I can't. Every time I speak with you, you remind me so powerfully of how important this is, and it's just so hard to break through that.
Is it called conditioning? Like we're conditioned a certain way. Society, our parents, our experiences condition us a certain way to show up being reactive. We got to put out a fire. You got to do this, the to-do list. It's never ending for women, especially. And so it's stepping back and that ability to think about what you're thinking and being a witness to your thoughts, that's called metacognition, right? So when you step back, you say, oh, why did I say that? Why did I do that? That ability to think about what you're thinking is really going to be powerful to slow you down and live intentionally or live without the conditioning. So you're more responsive and less reactive.
Those things like mindfulness or being intentional, it can sometimes feel like, again, because of our mindset of medicine, like, oh, that's very woo woo, or that doesn't really work. But to hear a medical doctor who's very focused on evidence and science talk about these things, I think is really powerful to get that perspective shift of how much of an impact something like breath work could have, because it doesn't seem like it would make that big of a difference.
It seems so simple. So how could we get something so simple so wrong, right? But most of us, if you look around, and when I see patients in my office, I'll look at their breathing patterns. And most of us use the top 1/3 of our lungs, but we have 2/3 of real estate of lungs. And oxygen is the drug of choice, right? We need oxygen for every cell in our body. When we learn to deep breathe and use all that real estate we have with our lungs, you breathe better, you live more intentional, you live more mindfully. So, what is mindfulness? Mindfulness is being aware, right? Being aware of your surroundings, and it's a heightened awareness of what you're doing. And what I learned is that when you're mindful or you're present, you can't turn on stress, ladies. So when stress occurs, it's either because we brought up a past experience or we're anticipating a future experience that hasn't happened. But if we put our attention, wherever your attention goes, energy flows, put our attention to the moment right now and in your present, then you cannot turn on the stress response because in this moment, you're with your breath, your breath, your mind, and your word, the BMW. So whatever word like Om or Amen you're using with your breathing technique, you cannot turn on stress. And we've measured that. People who stay present often have very low heart rates, low blood pressure, The brainwaves are in alpha state. So Tibetan monks, for example, we've studied them as subjects. We've studied Wall Street stockbrokers and measured their heart rates and their brain waves. So there's a lot of scientific data now to support that intentional breathing, deep relaxation, doing meditative prayer, contemplative prayer, all those activities actually slow down the nervous system and create a beautiful biological shift in your body.
Amazing.
For your younger audience, I should add something. Many of you are wearing Apple Watches or the Aura rings. You're measuring your nervous system. I did a talk for one of the Best Buy is a tech company, and they're looking at how biology and technology are interfacing. And the big exponential growth for their tech industry in Best Buy are people looking at ways to measure their nervous system and wearable devices. So the future is going to be that there will be devices that you can attach to your brainstem that will help you to calm down your nervous system. So if you can't master breathing techniques, it sends little pulses of electromagnetic waves into your nervous system to calm it down so you're not panicked or anxious. I would still prefer the breath work, but just know that, technology is catching up with our biology.
Keep it old school for now. Although I do wear an Apple Watch, but I always ignore when I get the mindfulness notification saying you should breathe right now. I just ignore it. I've seen the impact that breath work can have for sure. So I do try to incorporate that into my day because I find if I don't start my day with that mindfulness and intentionality and just breathing, then the day just gets away from you. And it's like you're not present. That's exactly it. You're not present in your day. And I actually think a lot of women in our community, I've read, we get feedback and people talking about daily health habits that they swear by. And a lot of women will put, my morning time alone or my morning time where I'm either meditating or my time in prayer. So I think there is that recognition more and more that is very important as a health or wellness habit.
That's the key word you said right there. It's all about consistency and creating rituals and habits that ground your body every day because there's so many things to distract us, right, Amanda? You wake up, there's emails, there are texts, there are people and kids and family, and everybody wants a piece of you. So how do you stay grounded? And I think creating that space in the morning, protecting that first hour, and having a habit of setting the tone every single day to say, okay, I'm going to go through life today. I'm going to have stressors. I'm going to have unpredictability. But how do I just show up being responsive, which is a measured, deliberate, thought out response versus reactivity, which is a very, very basic reflex. For example, you're driving along and somebody cuts you off. Your immediate reaction might be, oh, how dare that, how did they dare to do that? I'm in my lane. And, that's your reaction. But if you were intentional and grounded, you might say, well, you know what? That guy's in a real big hurry. Thank God we didn't have an accident. I'm okay in this moment. And maybe he'll get there safely, hopefully, wherever he's going. So the reaction and the response, what you just did by reframing it was that you put out different hormones and chemicals in your body because you chose to look at it differently. Do you see how many times that happens during the day?
That's a really good way of putting it. And speaking of reframe, you've got a reframe toolkit. Can you describe that?
Yeah, so when I wrote the book, The Mind Body Cure, I went through the whole chapters and you can read the chapters alone. But I said I have to have a way for people I wanted to create ease. And I think the easiest way to do it is to show them this reframe toolkit. I don't know if you can see that.
Cool.
You see
Okay.
the letters. Yeah.
Yeah, so you can see, and you can go on my website and download this for free. It's a bookmark, but I'll just go through the Reframe Toolkit because it's a good way for people to say, okay, how do I take all this stuff that people teach me? How do I just make it something I can adapt to my life? So reframe is the R is for reset. How do you reset your body? Through the breath work. We talked about breath, mind, the word, BMW. It's on my TED Talk, and that's how you reset the body. So there you are, physically in a state, and you can now just reset your body by doing the controlled breathing. So that's the first thing is reset your body. E is for exercise. And that's exactly what you all have been promoting because movement is so profound and intrinsic to being a human being or any living thing. Movement is key. And if we don't move, our cells get signals all the time. So it's move or decay. Movement is so important for the brain. Movement is so important for the bones. So movement is absolutely key to longevity and health. F is for food. And I'm always of the adage, let food be thy medicine. So what we're putting into our bodies, let that fuel for our engine be good fuel, the premium stuff, not highly processed stuff, not the inflammatory diet that the most of our food in North America is highly processed. I just went to Europe and we were talking to a lot of nutritionists over there, and they found that the food you could take a tomato or broccoli, and they found that our food in North America is more chemicalized. Our flour has more chemicals than their flour. So it was just comparisons, but the highly processed food industry is really impacting our endocrine system. You know, the pesticides affect our women's hormones. Young girls are starting periods when they're 9 years old. So I think re-looking at the food we eat is really important. The R is for rest. We are so inundated with um, texts and emails and our attention is constantly being fragmented. So it's really important to unplug from technology. On the one hand, we're using technology to educate and create awareness, which is wonderful, but sometimes we get too much of it. So while we look at our food as a diet for our body, we also want to look at our tech diet. So rest is really important and sleep is very important. The A is for assess and awareness. Awareness is the agent of change. So, what we're doing today is creating awareness of your nervous system. So, when you're aware that your nervous system either is going into fight or flight or going into rest and repair, you can then use that awareness to bring about more rest and repair in your body. So, awareness is absolutely the agent of change. And M is mindset. So, Amanda, you were talking about mindset. So, when I see patients in my office, I often can tell if a patient is a growth mindset or a fixed mindset. So when they're a growth mindset, they're very proactive. They ask me questions. Doctor, what do I need to do? It's a shared decision-making process when I'm with them. Some patients have a fixed mindset. Nope, I'm not going to quit smoking. If I'm not going to quit drinking, I don't want to exercise, and just give me a pill to fix it. So you see the difference is mindset that a doctor could be very passionate and very knowledgeable, but if we're working with a patient's mindset who's fixed, doesn't want to grow, doesn't want to change, then it's very difficult to bring about changes in their life. So the mindset is very important. And E is for examine. Connect the dots for yourself, but if your dots are not connecting, make sure you go to your doctor or practitioner. You know, sometimes patients have anxiety and you can connect the dots to your period. But if your anxiety is debilitating, you can't leave the house, or you're so depressed that you're thinking about ending your life, or you have so much OCD that your hands are raw from washing them, you need to go and see a doctor. You can't meditate everything away. So I want patients to realize that disease is a spectrum, mild, moderate, or severe. And if you have severe symptoms, please go and get examined. Okay, so that's a good toolkit, Reframe, and you can download a copy on my website for free. And it's to teach patients how to look after themselves to make their doctor's job a little bit easier.
Really great. I can't imagine anybody coming to you and with that mindset of, I really don't want to change anything because you're so inspiring.
No, a lot of patients want shortcuts these days. Give me a pill. I don't want. Look at the weight loss industry, and $14 billion we're spending on things like injectables, but that's much easier. And sometimes it's needed, of course. Look at the antidepressant industry. We're just spending a lot of money on drugs, but teaching people to take back and reclaim their power and use their internal healing systems, that's a harder sell because it takes time.
Let's talk a little about weight because healthy weight and staying or gaining, all of that happens in menopause and postmenopause lasts forever. So, a lot of our community is concerned with weight, and I know that the way you deal with it is integrated into all of your treatments. So, let's talk a little about how you view that.
It begins with, the mindset for sure, because the decisions and the choices you make begin up here. So we watched this experiment, and they took very stressed out group of women in one room, and then they had another room where they did a meditation class and yoga, and these women were very relaxed and said, "Now go on out to the cafeteria and pick your food." And it was so interesting because the agitated women who were embroiled in this big discussion about politics and they had to fix all these things. They went to the cafeteria and they're on a camera. And the ones who were very agitated, they went right for the carbs. So it's so interesting that when you're stressed, you choose sugar and you choose carbs. And the ones who were very mindful and they went out there, they went out and chose really, really mindful based decisions by choosing salads and vegetables and good proteins. So it was really interesting to see how we make our choices depending on where our headspace is. And so this, I think, is the starting point, is the choices you make. Because we all know good food when we see it. We all know bad food when we see it. We see a donut or we see a celery stick, like, the celery stick doesn't have your name on it, but we make choices, but we often will make choices based on what we're, reacting to. So it's really important to be more intentional about what choices you make. So food is really important. And then, of course, the exercise. But before I leave food, I just tell patients that they always ask me, which is the best diet? And I think looking at all the research, the modified Mediterranean diet would probably be my best pick because it has a lot of vegetables, a lot of salads, and they eat meat, but it's very good sourced meat and it's a small amount and lots of olive oil. So using antioxidants, the colors of the rainbow vegetables, very, very small amounts of carbohydrates that are refined. So that would be a good diet for most women. Then, if you're a diabetic, or if you're gluten-free, or if you're anemic, or you're vegetarian, then of course we can make selective choices for them. The other thing I should say before I leave the diet topic is that not everything is available in your diet, especially for women. You must take some vitamin D for your bones, and you must take some magnesium and omega. Those three things are shortchanged in your diet. So that's the diet in a nutshell. The second part of weight loss would be movement. And the three kinds of movement we love to tell our women, keep it simple. 30 to 40 minutes of cardio, high intensity moving, brisk walk, brisk slow run. Those are good ways to keep the heart muscle going. The second one is weight resistance, especially women as they get into their 40s and 50s, they'll lose muscle mass very quickly. And when you lose muscle mass, you actually lose brain mass and bone mass. Isn't that a fascinating finding? So that's the second one. The third one is about your neurofascia. Fascia is that Has anyone ever seen that thin membrane on meat? That's your fascia. It's connected to your nervous system. So when you do stretches or you're doing yoga or flow movements, those kinds of movements are really, really important for agility and fall prevention as you get older. So the three kinds of exercise again are cardio, weight resistance, and flow. We call it flow yoga or flow movements or dynamic flow, but it's just to keep your joints and the sense of proprioception because women fall a lot as they get older. But if they are doing things to keep themselves agile and active and coordinated, they fall less fractures.
That's sound advice. And I just want to go back to, why do we gain weight or, in certain places when we get into menopause? What's that science of that? Because it's always, you don't want to be on a diet. But what you're saying is it's a way of living. And so what is it about menopause and post that that this happens to us,
It was a really big shift in metabolism because the hormones are changing, and women start noticing that as they get into menopause, the muscle fat ratio is changing. We track muscle fat ratio, as you know, and we can see a slow climb in the fat content. So the distribution of fat and muscle is changing, your metabolism is changing, the way that you absorb food is changing because the hormones don't work in a silo. Hormones are all talking to each other. It's a symphony of hormones. So if your estrogen, progesterone suddenly stop, why is it that more women become insulin resistant? Why is it they develop more thyroid disorders after menopause? Why is it that women get more autoimmune diseases or they get absorption disorders or IBD? So all of those shifts happen because some of the hormones have now stopped in the ovaries, but it impacts the other hormones. So some women, when they're pregnant, for example, they will get diabetes. There's a connection between your estrogen and insulin. So my point being, the whole symphony of hormones works together. They all talk to each other. Suddenly at menopause, the hormones are changing and all the other hormones now respond in kind and they also change their effectiveness. So either become more sensitive or more resistant at the receptor level.
Thank you for that explanation. And that leads us to hormone replacement therapy and your experience with that. And that is one of the things that I came to you for. I had to change it later, but tell us a little about how you bring that into a woman's life.
Okay, so first of all, I should talk about the past, present, and future when it comes to hormones because we've got a terrible history, right? It started out in the 50s that everybody was put on the hormones. In 1950, there were advertisements in all the magazines. Take this hormone. It was from pregnant mare's urine. Believe it or not, Amanda, that's what women were given, were pregnant mare's urine and said, here, take this hormone that we've extracted from there, and their hot flashes got better. Then people got into trouble. Women started developing cancer. Then they said we better add some progestogen. So they added an artificial progestin. Now, why is it that women were given artificial hormones to begin with? We don't know because most of the hormones we use in medicine are identical to our own body. So it wasn't until 2002 this big report came out. Oh, these hormones are bad. Let's take everybody off the hormones. So in 2002, a report came out, everybody went off the hormones. But we threw the baby out with the bathwater because some women benefited tremendously from those hormones. So now the pendulum is over here. It says, put everybody back on hormones, but make sure it's bioidentical. It's identical to their body's hormones. So that's one. Number two, make sure you do an individualized risk assessment, which we started doing 25 years ago. Number three, make sure that the hormones are going through the skin because when you put estrogen through the skin, you bypass the liver. If you take anything by mouth, it has to go through the liver. When it goes through the liver creates proteins that makes your blood thicker and you're more prone to blood clots. So even young women who take birth control pills by mouth, now they're looking at ways we can give it in a patch or a ring because going by mouth puts you at a higher risk for blood clots. So we've come a long way. So now we don't even call it hormone replacement therapy, Gabby. We call it MHT, menopause hormone therapy. So if you're a good candidate and you've come to the clinic, you don't have breast cancer, and you don't have blood clots, there are a lot of benefits for hormone therapy. Your sleep, your skin, your bones, your hair, your brain, all of those benefits. The risks are if you have a breast cancer, you cannot take it. If you have blood clots, you cannot take it. But why we give it is because it's closing the gender gap. Remember earlier in the show, I said men produce testosterone, but women don't. They don't produce hormones after the age of 51 or 52. So our nursing homes fill up with women who have dementia or osteoporosis or incontinence. All three of those things are preventable. And by being on hormones, we lower the chance of dementia, osteoporosis, and incontinence in women. And that's why it's closing the gender gap. So in Europe, they've been doing this forever. They didn't stop. After 2002, that report came out, the Europeans kept going with transdermal estrogen and progesterone therapy. So their women, the rates for their admissions to nursing homes are lower than ours. And so in North America, we were really, really cautious of hormones. We're jumping back on the bandwagon now, but in our clinic 25 years ago, we recognized the importance of the individualized risk assessment, transdermal hormones, and making sure that we put into place a woman's lifestyle. Hormones alone can't fix your life. You have to still do the work. Exercise properly, eat properly, manage your stress, sleep properly. So those are things that women still have to be a part of the decision-making process. They have to do their part of the therapy as well.
Really clear explanation. Your clarity is so helpful. And then that's something that I'm interested in too, which is, let's say you either can't take the hormone or don't want to. How do you replace the estrogen and progesterone? I mean, what is it? Is it exercise and food? What other, are there any other methods? What do you recommend?
This is very interesting because in Japan, I went to do a talk there about 2 years ago, and they eat a lot of soy there. And
Mhm.
their soy is a little bit different than our North American soy, but those women don't complain that much of hot flashes and menopausal symptoms. They still develop osteoporosis later in life, but their longevity profiles are so strong and they don't end up in hospital with fractures because the older set in Japan are very active. They're moving all the time. They hold on to their muscle mass. So sarcopenia is when you lose muscle mass. But in the 9 blue zones that Dan Buettner studied, and I met him at a conference, and he was saying there's no gyms in Okinawa in this little town. There's no gym in Sardinia or Icarus in Greece. But the people there in their 80s and 90s were still going up the hill to church or tending the garden or tending sheep in the pasture. They were moving all the time. So I think hormones not the be all and end all. I think if you don't fix your lifestyle, um, that's the most important, and you can still make low levels of hormone. But if you're at risk for osteoporosis or dementia, taking the hormones definitely helps the quality of life and mitigates your risk for developing those chronic diseases. So I would pick my patients carefully, and hormones can be very safe for most people, but have a talk with your practitioner to see if it's right for you.
Yeah, and then you're talking about soy. It's a phytoestrogen, I believe, and there are other foods that do seem to have those qualities.
The phytoestrogens, flaxseed is also a really good one. Chia seeds, omega-3, those can be helpful, but they are not the same as hormone therapy. So not all hormone therapy is the same. Some are systemic, some are topical. So some women say, well, I don't have any hot flashes. I don't have risk for osteoporosis, but I have terrible incontinence or burning or pain with intercourse. And there are so many options. Women do not have to suffer anymore. They can use very safe topical estrogen in the vaginal bladder area so they can have intercourse safely and without pain, and they don't develop incontinence when they're 70 or 80 years old. So I think the education is really important, that you may not need systemic hormone therapy, but you might need topical. You might need both. You always have to look at your risks and benefits and see what's right for you. Food is helpful, but for some women, that isn't enough, unfortunately.
There's something you said that I want to just say again really clearly, and that is women don't have to suffer anymore. Because I think, you know, a lot of women just feel like, well, it's normal to feel this way. It's normal to suffer. It's normal to go through this. It's normal to have pain, to have incontinence, to have all of these issues. It's normal.
Isn't that something, Amanda, right? Because if you just look at the history of women, I mean, in obstetrics, anesthesia wasn't introduced until 50 or 60 years ago, and if it was a man, or if it was a man having menopause, for example, it's a castration event. Would a man put up with that? So men and their expectations of what they deserve, just I'm speaking in generalized terms, women will put up with a lot more, and they almost have this internal, or society has this internal built-in, yeah, women have to suck it up. Oh yeah, they have it hard, but that's just the way it is. That's a part of being woman. But now the new generation is not taking it at all. In fact, I did a talk the other night and it was for 35 and 40-year-olds, not 50 and 60. And those 35-year-olds said, you know what? I'm not going to be prepared to have this severe PMS and just suck it up. I want answers. I want to go to the root cause. I want to have a better quality of life. So I think it's consumer driven, that more and more women are becoming aware, realizing they have choices, and now with the internet, they can explore what their options are. So I think it's a good age to be a woman of any age. It's a good time to be a woman of any age.
It's very hopeful because it's true. I wouldn't call it being martyrs, but you learn to deal with it. I mean, it's tough. And one thing I'm finding as I get older is it doesn't get calmer. It gets more intense. I think partly it is technology and the times we live in, but it's also more demands on our time in other ways. But I think there is a path through, and there is hope, which is always nice.
The second book I'm writing is all about hope for women. It's called Ovaries, the Owner's Manual. So all women with ovaries, we're taught a lot about our bodies, but no one pays attention to those little tiny nuggets. And that's what forms our, puberty to menopause. It's our ovaries. And we only have one chance at protecting that precious cargo, that genetic DNA that we carry for future generations. But no one actually gives you an instruction manual on
Oh,
how to look after the ovaries. So in the book, yes, there's information, but there's also a lot of hope and and future, how do we protect the younger generation, the older generation? But if we can teach women to look after their ovaries when they're young, then those ovaries will serve them better when they're in their 50s, 60s, and 70s. They'll function a lot better.
That's very cool. I'm excited to read that. Wow.
sign me up. That is a wonderful topic. I've had issues with ovaries too. I mean, and it is something that we don't ever talk about. We don't even know anything about hardly.
There's a lot of projects I have. As you know, I see patients, but I do a lot of other things, and I'm passionate about education and just making sure that women make informed decisions about their health. I think an informed woman and a healthy woman has such a beautiful ripple effect. Her friends are healthier, her children are healthier, her husband's healthier, partners are healthier. So having a well-informed, healthy woman has what I call the lovely ripple effect. So if I get one woman back up and running, that means I've affected the whole family. And when you affect families, that affects societies and affects populations. And so it just keeps on going outward. So I love that I'm a part of that journey, hopefully.
I love that. That's a beautiful image. And we completely agree. We're all about women feeling empowered in their health and wellness. And especially, yeah, the educational piece is so important. And, we don't know what we don't know. And like we said, so many women are just used to sucking it up or suffering, or they're dismissed by the medical system or their doctor, and they just don't know that there's another way, or that things could be better if they were to implement just even some of what we've talked about today, like is life changing. And again, it's like, it's so simple, but it really is life changing. Even to just start a regular breathing practice every morning, like that could change your life. And I think it's so hard for women especially to feel like they deserve to take that time, and it just feels like it's not enough to just do something simple.
Time and energy are two very important commodities for women. Would you agree? Time and energy. Because what I hear in my office, I don't have time or I'm just too tired. So if we had time and energy and you wake up in the morning and you decide, where am I going to spend that time and energy? So, y- the analogy of the oxygen mask is probably the best because when, you have to put the oxygen mask on first, and then go around, put the oxygen mask on everybody else. That's absolutely key. So protecting your time in the morning, setting the intention for self-care. It's not selfish, it's self-full, in fact, because when you look at a family unit, if the woman is thriving, and not just surviving, she's thriving, the family thrives. So if she's doing well and she can give because her cup is running over, then the whole family benefits. But if she's suffering and she's exhausted and she's run down, the kids are not going to get the best version of mom. The husband's not going to get the best version of mom. The work is not going to get the best version. So your best version, no one is coming to take care of you. No one is coming. So women have to look in the mirror and say, okay, I have to honor myself and do this for myself. And self-care and setting boundaries and setting time and energy aside for you, using kindness and compassion to yourself, I think is one of the key messages that I would say beyond medicine, beyond all the prescriptions. I think it's an important message for women to receive and implement in their lives.
It's so wonderful that you have this mission. Chronic pain is something that women struggle with. And so how do you manage that? How do you help them manage it? And how is it related to all of what we've been speaking about?
Yeah, that's a great question too, because we don't think of pain as a hormonal problem, do we? Has anyone thought about pain as hormonal? So think about this. When someone's in chronic pain, and I had been, right? I was in the car accident with multiple fractures. So I went through pain, and wherever I went, the neurologist, of course I had surgeries, but it was, here's an anti-inflammatory. Well, that was hard on my gut. Here's a painkiller that had side effects. So it was always pain was given this thing that it's outside of you, but you can just take something to snuff it out. In fact, when we perceive pain, pain is perceived here in your brain. But when pain signals come in, your nervous system receives that signal and cannot tell the difference between pain or a dinosaur chasing you. So your nervous system is that engine I talked about. It is always there scanning the environment to see if there's danger, right? So our nervous system is quite primitive. It hasn't evolved. Our neocortex has evolved. We can put man on the moon. We have artificial intelligence. We have all kinds of things. But our nervous system is still receiving very primitive signals. So it can say it's either a threat or a not threat. When pain comes in, it's a threat. So the nervous system revs up. When it revs up, it produces adrenaline and cortisol. So every pain signal produces cortisol. So you're in a lot of stress when you're in pain as well. So that's important to understand. And the reason is when you're in chronic pain, when I see patients and treat them, they form a triad. It's like a triangle. At the apex, you have pain. On one corner, you have anxiety. On the other corner, you have sleep issues. And they usually go together. And around we go. When you have pain, you don't sleep well. When you have pain, you have more anxiety. When you have anxiety, you perceive more pain. When you have anxiety, you can't sleep. When you can't sleep, you have more anxiety. When you can't sleep, you have more pain. So it goes around and around. And until we address that triad, you cannot break that cycle of pain. And that's what I learned is that going through the program at the Harvard Mind Body Institute, that's why it was personally so transformative for me, is that I learned that if I want to control pain, I had to control my anxiety and PTSD from the accident. And once I was able to regulate my breath and do some reframing, my chemistry changed because we have a built-in pharmacy in our body, right? We make adrenaline, cortisol, but we also make endorphins, natural painkillers, and we make DHEA, oxytocin. So you have a built-in pharmacy to repair your body, but it doesn't turn on when you're in chronic pain or survival mode. So I had to get out of survival, fight or flight, get into the parasympathetic nervous system through relaxation techniques, mindfulness. And then I started shifting my pain perception. I got off all my painkillers, got off the antidepressants they had prescribed, got off all the medication, and learned how to control pain. So if you look at all the pain clinics now in North America, they include mindfulness, meditation, because they recognize that if we just give people painkillers, look what happened with the opiate crisis.
Right.
Those weren't people that were drug addicts. They were just prescribed oxycodone and got addicted, right? So every action has a reaction. So if we can teach that healing comes from within and use painkillers just when we absolutely need it, or something to sleep or for anxiety, but breaking that cycle, that triad is the best way to treat chronic pain. Because often patients will be diagnosed with chronic fatigue syndrome or fibromyalgia. But what is that? It is a chronic dysregulated nervous system that is playing with the adrenal gland, and the adrenal gland gets so exhausted that you're not making your cortisol anymore. So you get severe fatigue and pain.
Such a great explanation because it's because our nervous system's so primitive, I guess, and that's something that it's interesting that some of our body is more advanced, some of it isn't, and but we do have some agency over it.
We do have agency.
I'm just thinking for a woman who's listening right now and is thinking, oh wow, yep, that's me, the triad, pain, anxiety, sleep issues. You know, what should she do? How could she get help? What could she do herself? And then next time she sees her doctor, what could she say to be taken seriously about those issues?
First of all, we would have to know how debilitating is the pain. If the pain is so debilitating, she's not able to go to work. She's not able to look after her children. She's not able to, function in a household. You have to see how debilitating it is. And if it's severe, obviously she's not going to be able to do this on her own. She needs a multimodal multidisciplinary clinic that such as we have a few in Vancouver, and I can give those to you if you need on our resource list later. But they look at mindfulness. They do look at some painkillers that are non-addictive as well. So there are some good drugs that are non-addictive that they can use to break the cycle. They look at sleep induction. So those clinics will look at it from that point of approach if it's a severe, but if it's mild chronic pain and the woman wants some tools for, handling that at home, I think using about 4 chapters I can think of in my book that address the fatigue, that address the pain, the anxiety, and how to downregulate pain symptoms. Because remember, I said, wherever your attention goes, energy flows. It's so interesting. I could have a person sitting in front of me having a panic attack, and I could say to them, take some deep breaths, and they don't hear me. But I tell them, just close your eyes, and I put something in their hand. Okay, I put something in their hand. I said, now close your eyes and describe what's in your hand. And suddenly I diverted their attention and I said, okay, what's in your hand? Well, it's cold, it's metal, feels like it's glass. And suddenly their attention got diverted and I asked them to take some deep breaths and they were able to control their breathing. In the same way, what happens is when you have chronic pain, it's noise in your brain, it's brain waves all the time. So, learning to divert your attention to something else, being in nature, looking after a baby, looking after a pet. You know, pets can help you regulate your nervous system, babies can help you regulate the nervous system, horse therapy. What is all that about? It's that we can co regulate each other's nervous system by diverting our attention to another. That's one. Mindfulness, using some natural things for pain, such as arnica. Those are some things that are listed in my book that patients can do to address chronic pain and fatigue.
Thank you. That's super helpful. And if she is going to see her doctor, is there something that you would recommend that she would say to be taken seriously?
Yeah, that's a great point because often doctors are very busy and they're looking for um, a certain language that you come in with so they don't so you're not dismissed. If you're all over the place, that's not going to be a good way. It's best to have your symptoms documented and how do they affect you. So having a documentation of your symptoms, so say my pain, 0 to 10, it's about 8 out of 10 all the time. And if I do something, goes to 10 out of 10. And how does it affect me? Well, I'm not able to cook dinner for my family. I can't empty the dishwasher. I can't pick up the baby. So those are ways, your symptoms are quantified, and then qualitatively, how's it affecting your life? That's a good way to document. And then another one is, you know, what can we do together to help me get through this? What are my options? So posing a question to the doctor in this way forces him to start thinking, okay, what can I do to help this woman be herself again? And what are the options I can outline? Because there'll be medical interventions, there are physical interventions, there are wearable devices like TENS machines. He could go through the whole list, but she has to get him focused. So that doctor has just been with 30 other patients and he's compartmentalizing each time he's with one patient. Your job is to bring his attention to where you are, to see you, to hear you, correct? And this is the best way to do it. So bring your symptoms, bring how it's affecting you, and then ask the question, Doctor, I really want something to change. I want to be myself again. What are my options to get through this? Can you help me? Like it's a shared decision making, and that invites him into the conversation.
And I think that will be very, very helpful for a lot of women to just have something that they can feel prepared with when they go into those conversations, which can feel so challenging.
And I think as a doctor, what is intimidating is when a patient comes in and they've got this big, thick ream of paper. Doctor, I've been searching on Google and I've got these. What do you think of it? They don't have the time. That's why it's really important for you to make it concise. Your symptoms, the effect on you, what are your options? And that's how when we write our notes for a patient visit, it's written as a SOAP note. Do you know what SOAP means? Subjective. What is the patient feeling? Objective. When I examine them, what do I see? A, assessment. P, plan. So if a patient comes in knowing that the doctor is documenting in a SOAP note, then presenting the data in a SOAP format, and this is all over North America, the United States, the UK, all doctors are trained on a SOAP note. So this will help your patients to take that tool, say, that's how he's writing it. I got to present it like this.
That's so excellent. And I loved what you said earlier. No one else is coming. No one else is coming to
No
take
one's
care
coming.
of Dr. Pawa. It has been just so wonderful talking to you. I feel like I've learned so much. I'm going to take away so much. I'm going to revisit your book as well. And I feel like, there's some really practical tips and advice, and also just understanding that you've laid out so clearly. Like, I really feel like I've learned a lot.
Great.
Where can people find you online?
I have a website, drbalpawa.com, and that's where you can get the free Reframe Toolkit. And then I'll be putting a little bit of information about the upcoming book as well. And there's lots of free information on blogs about, mindset and how to handle stress, and some on women's health as well. And then I'm also at the West Coast Women's Clinic. There 2 days a week, but I'm not seeing any new patients, but I'm training a lot of younger doctors to take over and practice medicine that we started, the integrative approach to women's hormone health.
Thank you so much for your time.
I love your team. I love that you've got a younger perspective, a more wisdom perspective, and I love what you're doing for women out there. So keep up the great work.
We feel the same. Thank you. And yeah, it's just fantastic.
Take care.
Thank you.
Thank you. Okay. Bye-bye.
Bye.
Bye-bye.